basically, LASIK is a type of laser eye surgery. So we're operating on the front of the eye, which is the cornea. So it's the very front part of the eye. So you can see in my little eye model here, this is the cornea here. So laser surgery is all on the surface of the eye, and LASIK is a type of laser eye surgery. So there's multiple different types. There's LASIK, PRK, and SMILE. LASIK is the flap-based laser surgery. So I create a flap on the cornea, I lift the flap, I do the treatment, and I put the flap back down with my laser. And PRESBYOND is a type of LASIK procedure. So we're still doing traditional LASIK in terms of the surgical process is the same. However, the lasers that we use, so we have Zeiss lasers with the special PRESBYOND platform. So the lasers we use are very specific for this presbyopic profile that we put into patients' eyes. And with that, we have to take very specific measurements of patients. So it's individualized to each patient. So the beauty of PRESBYOND is it's a very mainstream procedure in the sense that we're just doing traditional LASIK, but we're using a very elegant and highly sophisticated program to essentially input certain numbers into the eyes to give you that range of vision that we'll talk about a bit later on.
Okay, so when you say a range of vision, is this what you mean when you talk about a blended vision?
Yes. So as I mentioned before, with PRESBYOND or with this laser blended vision, we're not only correcting for pre-existing scripts or refractive errors, so pre-existing long-sightedness or short-sightedness, so we can correct for that, but we can also correct for the presbyopia or the near vision loss. And we do this by essentially making one of your eyes or your dominant eye is corrected for distance vision up to about the computer. So distance to intermediate. Your non-dominant eye is corrected from the computer to near. And that whole range of vision between your two eyes, which your brain processes, is the blended zone. So you'll basically have blended zone from distance through to intermediate, which is your computer, through to near, across your two eyes, which corrects your pre-existing script, but also gives you that near vision that obviously is becoming an issue for the 40 to 60-year-olds.
Right. So when we hear people talking about monovision, that's really just correcting for a specific distance,
Correct. So
isn't it?
it's
Which is
actually
not what you're doing.
exactly.
Yeah.
It's a bit different from monovision. It's just a kind of more sophisticated version of monovision. So monovision is a little bit more rudimentary. It's very good, but it's basically your dominant eye corrects purely for distance, and your non-dominant eye corrects purely for a certain distance at near that we preset. So it's completely it's very rigid. You're just able to see your iPhone at this distance. If you move it here, it goes out of focus. If you move it here, it goes out of focus. It's set for a focal point. With PRESBYOND, it's blended vision because you have a continuous range of vision. It's a continuous range from distance through to the computer, through to near, through to even if you bring it further up close, because it's taking into account a little bit of monovision. We use that as one of the many principles that we adopt as part of PRESBYOND. So we have a little bit of monovision, but we also couple that with some other sophisticated things like what's called spherical aberrations, which sounds very fancy, but basically we're just optimizing the eye to increase our natural depth of field. Okay, and we get that through our technology, so we can measure, for example, your spherical aberrations, and we can put that in our laser to get not only that monovision, but we also get that depth of field, which is why we have that blended or continuous range of vision.